And to help us make sense of where we are in the fight against the coronavirus, we'd like to bring back our friend Dr. Richard Besser. He's a former acting director of the CDC, the president and CEO of the Robert Wood Johnson Foundation, and ABC's former chief health and medical editor. Thanks for coming back on the show, Dr. B.
Thanks, Lindsay. It's great to be here.
So we've been hearing some mixed messages, as you know, about the timing of a potential vaccine and when it might widely be distributed to the public. Who should we be listening to in this moment, and when do you think Americans could get vaccinated?
Well, I think we need to listen to our public health leaders, and that's who we should have been listening to and hearing from since the beginning of this. You know, one of the things that really struck me yesterday, Lindsay, was that it was the first time in so long that we'd been able to hear from the head of the CDC, and it was only because there was a congressional hearing. You know, we should be hearing from him every single day. And his big takeaway point is that for a long time, the biggest impact we're going to have is by people wearing masks and keeping away from each other and washing their hands and those basic public health measures. A vaccine is not going to ride in and save the day.
And again, as you're well aware, President Trump has contradicted his own CDC head, who said that mask wearing could be even more important than a vaccine in our fight against the virus. Who's right here?
Again, the head of the CDC. You know, around the globe, countries have been able to get this under control with wearing masks and keeping socially distant from each other. And there is no vaccine. And, you know, I think it's really important that we try and adjust people's expectations about a vaccine and continue to use the word if there's a vaccine, because none of these trials have been finished. We have absolutely no idea how effective any of these vaccines that are in trials are going to be, or that they're safe. And until that information is known, and until scientists can look at that data and say, okay, we believe this vaccine is good and that this vaccine is safe, till all that happens, it's really premature to talk about when a vaccine will be put into people's arms. I don't think there's any guarantee that we will have a vaccine. I'm optimistic, but we're not there yet.
When you say that you're not optimistic or you're not sure that we will have a vaccine, what, within a certain time period?
Well, you know, if you look at the past 20, 30 years and the efforts of science, they don't always deliver when it comes to vaccines. You know, some of the biggest infectious disease threats in the world, malaria, HIV, dengue fever, hepatitis C. Scientists have been working for decades, and we don't have a vaccine against any of those diseases. So it's terrific that there are so many companies that are working to try and develop a coronavirus vaccine. They're trying different methods. And, you know, I hope that one of those methods comes through. At this point, you know, it's just early days. You know, they're in their trials to see, do these vaccines work, and you know, how effective could they be?
All right, that's a really good point. And Dr. Besser, also, of course, you headed the CDC during the Obama administration. What's the typical dynamic like between a president and the CDC director? And what happens when there's a disagreement?
Yeah, I mean, there's always tension between those who are in public health leadership and those who are in political positions, because, you know, when you're in a political position, you always want to be able to deliver good news. And science doesn't work that way. Science tries to be true to the studies and what you're truly finding. During the H1N1 pandemic in 2009, you know, I had the fortunate position to be working under a president who said that everything we do will be based on the best available public health science. And I remember briefing the president and the cabinet on what we were doing. And the following day on his radio address, President Obama hit every single message that I had laid forward to the cabinet. And so what you were seeing was an amplification of the public health message, not this conflicting message that we're seeing today, every day, you know, between the White House and public health.
And finally, are you concerned at all that the scientific community is being politicized? I mean, just as an example, the magazine Scientific American, for the first time in its 175-year history, endorsed a political candidate, and it was Joe Biden.
Yeah, you know, I think the more we can do to keep politics out of science, the better. But that being said, people have to go with their conscience. And if they feel that there's a barrier to good science going forward and decisions being made based on science, people need to speak up. There are a lot of people who've been calling out this administration for what they've done to politicize science. And that's critically important, that we can't take this as a given if we want that to change.
Dr. Richard Besser, we always appreciate your insights and your time. Thanks so much.
Thank you, Linsey.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.